name is Asem Suleymanova. I am a second-year master's student, Department of Global Health. And I'm presenting my poster, which is quality of electronic medical records that I've done for my practicum during the last summer. And we really wanted to know about the quality of electronic medical records, especially within the health information systems, because we found that data that was presented in the literature, they talk about quality of health information systems. They talk about quality of healthcare by using electronic medical records, but we couldn't find any definitions of quality of electronic medical records itself. That's drove us to start to do a scoping review that we've done within the DG team at iTech. And we use STIF framework, which is presented by the Institute of Medicine, which stands for STIF. It is safety, timeliness, equitable, efficient, and effective, and also patient-centeredness. And we wanted to map our findings into this framework. And our findings are that in the literature, they presented more about interoperability, which is data exchange between health information systems, and it can go into several domains of STIF framework. For example, it can be safety, because interoperability data should be safely exchanged and secure exchange data, patient data. And the second one is timeliness, because we want to have patient data in a timely manner and exchanging health information data between different healthcare facilities in a timely manner. So, and we found that people concerned more about usability, because users that use these tools, they want to have very manageable tool, and also safety, because we want to have our patient data in a safe place. And this brought us to do a qualitative study that I have a couple of slides that I am preparing for my thesis defense. It was part of my practicum work, and then it flew to my thesis, which is qualitative study that we've done with 27 participants around the world. So we conducted interviews with 27 participants from 14 countries. So people were from Southern Africa, from East Africa, from Central African region, and from other countries like US, United Kingdom, and Switzerland. And the interesting fact that we wanted to know their responses related to their background and role that they play. For example, we had EMR builders and implementers who interact with tools and who make sure implementing of the electronic medical records in more efficient way. And also we had decision makers who are people from the ministries of health who are accountable for implementing EMRs. And also we had domain experts. They are people who are advisors or high level of advisors that not implementing the tool, but they give advice. They have like a champions in this field. So, and our findings that they are similar, like there are some alignments with the literature that we've done for scoping review. For example, we found that the most mentioned STIF framework domain were timeliness, efficiency, and effectiveness that we found out in our qualitative research too. But we realized that patient-centeredness and equity, the two domains, were less mentioned by our respondents. So, and we found that it's still there is a gap in terms of equity, because the tool that we deploy, that we implement, that should be available for everyone, despite the fact that they live in different regions in the world, and can be accessible for as for providers and for patients too. to access for patient data. Yes, I guess that's pretty it. And the more involved people were EMR builders and implementers, because they are interacting with the tools on a daily basis. They are deploying the tools, and they are also focusing on the quality assessment of the tools.
My name is Yao. I'm a PhD student in Global Health Implementation Science at the Department of Global Health here at UW. And this is my poster. So the key message is, compared to paper registries, laboratory information system improves data timeliness, completeness, and validity, and the improvement sustained over time until at least 72 weeks after the labs adopted the electronic laboratory information system. So we did this impact evaluation of how this laboratory information system called Open LAPIS in Côte d'Ivoire in 2021, but the time frame for the whole study is from 2014 to 2020. And we went to 21 labs to collect over 1,000 lab weeks of data. So on average, we had 34 weeks of data from the pre-information system, which means in the paper registries, and then also on average 53 weeks of data from the Open LAPIS servers. And then we did a comparison of data quality in terms of the data timeliness, completeness, validity between the paper and the electronic information system. And this is an interrupted time series design, so a quasi-experimental study that we studied any differences between the pre-trend and the post-trend in the data quality outcomes. And we hypothesized there will be an immediate improvement in the outcomes, as you can see here, and also a potential sustained improvement throughout time. And what we found is that data timeliness had an immediate 5-fold increase as the lab started to use the Open LAPIS information system. And this increase sustained over time until at least 72 weeks after adoption. And for data timeliness, there was an immediate 3.6-fold increase compared to the paper registry trend. And this improvement has also sustained after adoption, and we also see an enlarging gap between the information system data quality outcome versus the paper registry data quality outcome if the labs had not adopted Open LAPIS. But in data validity, we don't really see any immediate improvements, because when the labs were using paper registries, they were already excelling in data validity, but the information system sustained that 100% performance. So this is what we found, and this is important evidence to the evidence pool supporting the utility and the contribution of interventions such as an electronic laboratory information system in low resource settings. Thank you.
Hi, my name is Casey Amshauser, and I am a Senior Digital Health Specialist with the Digital Initiatives Group at iTech, which is part of the Global Health Department here at the University of Washington. I am here to talk to you about Open LAPIS, which is an open source laboratory information system that we've helped deploy nationwide in quite a few countries. And this particular study centers on Côte d'Ivoire in West Africa, where Open LAPIS is deployed at 128 different labs, everything from the general hospital labs all the way up to tertiary reference level labs in the country. This particular study, we're looking at routinization and some factors in either a successful or not quite as successful implementation of the lab information system across both reference and regional laboratories. So the aims of the study were to look at which labs had high routinization and low routinization of Open LAPIS use. And this means what percentage of total days out of a month did the lab record results, whether they were open or closed. And looking at the total number of routine open days in the lab, it's looking about 65% would be somewhere near the full routinization range if people aren't working on weekends and holidays. So that means the high routinization labs basically use them 100% of the days, and the low routinization labs maybe 50 to 60% of days which they were open. So we took those high routinization and low routinization labs, and we looked at what were some common barriers and common facilitators to that routine use. We did a convergent parallel mixed methods study, which means that we did both quantitative and qualitative at the same time. So we took that total percentage number of days open, looked at, did some semi-structured qualitative interviews where we talked to the lab staff and started talking about some perceived barriers and perceived facilitators to successful implementation. And we found in the end that common across all of the different labs, lab staff liked the software system better than paper registries. They found it was a little bit easier to use and could see some advantages to it. It was easier for them to feel confident in using the system and feel good about it when there was a lot of training and otherwise support after the initial implementation. And finally, different figures of authority within the health system and within implementing partners are reinforcing use of the system for reporting and routine lab use. Some common barriers are all things that are extremely common in low resource settings. So power and server outages. So anytime you don't have power, an electronic tool is significantly less useful. There's printing costs, which I think is interesting because we don't oftentimes think of printing costs as being a major factor in lab use. You know, how many sheets of paper are we using for each lab result isn't normally an important an important consideration here in the US, but other places, you know, these are really coming down to nitty-gritty tiny costs that do add up over time. And then finally, space limitations. Oftentimes these labs are pretty small. There's not always room on the actual physical benches for workstations. So the outcomes, some barriers for low routinization labs where they didn't feel like they quite were as mature in use of OpenELIS. They found the software was a little bit more complex than labs that had a higher routine use. And they had more concerns over staffing, so how many staff were available to actually do the data entry, do some extracts at the end of the month for reporting and such. And they were also more stressed and distrustful about even using the system. Why is this here? Is this here to do surveillance on us and see how we're performing as a lab or not? And then finally, across all labs, our outcomes were that ensuring infrastructure stability for all labs, it sounds pretty simple, but the more often we have power, the more often an electronic lab information system is useful. Refresher trainings and support visits are very important and really help labs feel strong about their use of the system. And then finally, we need to look at this over an even much larger period of time to look at true sustainability and what are some factors looking at even more than just routine usage. So, please visit our website. There is definitely a lot more information online.
Hi everyone, my name is Yang Fang and I'm the co-founder of LAPIS, standing for Learning for Action in Policy Implementation and Health Systems. And for this year, we started a new course. It's called Comparative Health Systems. And for next year, we are going to offer the course again in the autumn quarter. So this is the course ID, and then you will be comparative health systems from a financing perspective. Because for us, we really want to offer the opportunity for students to be the T-shaped scholars. In terms of the T-shape, like the horizontal bar representing really broad understanding about health systems and the knowledge about different country health systems. And then in terms of the vertical bar, it's representing the deep dive into the financing system. And for this course, we will really enable you to answer the question about what is health system. And for us, we are going to introduce like the two frameworks. For us, health system is really a mean to an end, and this is the control knob framework, and then it was introduced by the experts at Harvard and the World Bank. And another framework is by the World Health Organization. So we will also introduce all of the health system efforts as well as the disease-specific programs. And then you will have the opportunity to really understand about all the debates, whether to invest more in health systems or towards disease-specific programs. Or even better, maybe we can take the diagonal approach by integrating two kinds of programs. And for this course, we received the Curriculum Innovation Award from UW Office of Global Affairs in this academic year. And we are so lucky to have the funding to enable us to purchase the slides as well. To enable us to purchase the cases from Harvard. And in this course, actually, those are the testimonials from the students in this year. And I'm really glad that, like, for example, for the MPH student, they enjoy the doctoral seminar style of the class. And then for our doctoral students, they think actually the framework can be applied in their both academic work as well as consultation work. So I'm really looking forward to see you in the course next year. Thank you so much.